Novo Nordisk, Eli Lilly, Hims and Hers, all seeing increased demand for diabetes and weight loss drugs. In response, more employers are offering insurance coverage of these drugs, up to 34% now, from 26% in 2023. That's according to a survey by the International Foundation, I should say, of Employee Benefit Plans. Employers' overall medical claims spending on the medications also rose to 8.9% so far in 2024, from 6.9% in 2023. So, how do you know if your job provides coverage? Our next guest has a solution, and I'm joined by Reitano, who is the co-founder and CEO of Ro. You also stand to benefit if more employers start to cover what they hadn't before here. So take us into the thinking for Ro's business, and are you seeing the same type in spike and demand here that we're hearing from companies like Hims and Hers, who just raised their own guidance because of that demand for weight loss drugs?
Yeah, thanks for having me on, Brad. We are seeing overwhelming demand for our Ro Body membership, which is high quality care centered around GLP-1s. Why we built this tool is because after helping hundreds of thousands of patients start their weight loss journey, we saw that the number one problem that they had was understanding their costs at the beginning of their journey. And that should be table stakes in any experience, let alone healthcare. And the difference between being covered and not is a few $100s a year if you're covered usually versus $12,000, right? And when patients don't know if they're covered, what that ends up doing is it prevents people from seeking care in the first place, which is the number one reason why patients don't start that journey, is sort of the unknown cost. So we built this tool to help patients understand whether or not they're covered and how much they would have to pay to get access to GLP-1s. You put 34% there. We're actually seeing higher numbers than that on our side. We're seeing about 45% of our patients be covered. And when they are covered, the vast majority are paying less than $100. And so when you're covered, you're really covered. And so we wanted to build this tool to increase access to these treatments.
Should those prices be even lower? I mean, as of midpoint this year, it sounded like that the average price for GLP-1 drugs, and this is the list price, $1,000, but if you have insurance, obviously that comes down dramatically depending upon what you're paying into insurance. That could be even, $25 for a 1 to 3 month supply, according to, some of the compilation of the American Journal of Management, WebMD, and so forth. Yeah. So what is the true fair pricing for these drugs, given the demand profile that we're seeing?
Yeah, Brad, you're getting at sort of one of the largest sort of fundamental flaws of our healthcare system right now. The only people paying that list price, that $1,000, are patients without coverage or those that are uninsured. So patients with coverage, which you listed about 34%, again, we're seeing 45%. Because you'll have commercial payers. You also have about 18 states for Medicaid that are covering it. You do see Medicare cover it. All federal employees and their families have coverage. So you are seeing coverage rise. You have over 50 million people in the US who are covered for Wegovy. So when people are covered, which is tens of millions of people, the average copay we're seeing on our platform is about $50. So when you're covered, which is what this tool is trying to help people determine, are they covered or not at the earliest possible point in the journey to help them navigate next steps, we're seeing a very, very affordable price with coverage. And then hopefully over time, we obviously see these coverage rates increase. So that's, again, one of the challenges. That list price is unfortunately, it's way too high. We want them to come down. We're seeing more and more competition. We're seeing savings cards and we're seeing coverage increase. So hopefully over the coming years, we will see fewer and fewer people actually pay that list price.
When we think about the unknown costs of weight loss drugs, we know that, it changes how you might eat, changes the type of exercise you should be doing on the other side as well. What are some of those cost considerations because of the change in lifestyle that people should be keeping in mind even as they're having these key discussions with their medical practitioner or doctors?
Yeah, we've seen a lot of really interesting things, and what we talk about internally related to GLP-1s is we refer to them as a jetpack for positive behavior change. because what we see is this immediate and positive feedback loop for patients in their life. So it kickstarts a lot of behavioral changes, right? So you traditionally see a reduction in about 20 to 30% of calorie consumption, but it's not just patients are able to eat less and reduce intake. Also, what they are eating dramatically shifts, right? They're eating more vegetables, more fish, more poultry. They're eating far less snack food or confectionaries or soda and things like that. And when they're able to do that, you're seeing them sleep more, you're seeing them exercise more, you're seeing them date more. So you're seeing a lot of interesting positive behavior change that are kickstarted by starting GLP-1s.
Okay, so get ready to date more. Get ready for those expenses.
That's right.
Zach, just lastly, while we have you, we only have about 30 seconds here, but I'd be remiss if I didn't ask you about how the business is doing itself. I know that you're a unicorn status as of right now, and your own story in itself is something really to be talked about in your own evolution from selling, I think it was tacos or burritos or something like that from a friend's couch. I mean, look, we could go into that another day, but how's the business doing in this environment right now, and what is the next step, next major milestone you're anticipating?
Yep. It's a great question. For us, we've been, as you mentioned, we've been really overwhelmed and excited by the demand for our products and services. And so growing incredibly quickly, we've helped millions of patients across the country, one in almost every single county across the US, and have helped hundreds of thousands of patients start their weight loss journey. And hopefully just the beginning for Ro and the team.
It was burritos, by the way, just for our viewers out there. You were doing the good work of ghost kitchens, but we're so glad that there's so much more work you're doing on the healthcare side as well here. Zach Reitano, co-founder and CEO.
Appreciate the time, Brad.
Thanks so much for hopping on.
Thank you.
Appreciate it.